Hi, I'm the List Girl and welcome to my videographic journal. Today's topic is about burnout. An autistic burnout is a state of physical, emotional, and mental exhaustion that occurs in autistics as a result of prolonged exposure to overwhelming environments, social and/or cognitive demands. This can happen when individuals with autism are pushed beyond their limits, either by external factors such as work, school, or social expectation, or by internal factors such as self-expectations and self-criticism. But burnout can also occur if an autistic experiences a prolonged meltdown. Autistic burnouts can manifest as a sudden and significant decrease in our ability to function, which can impact an individual's ability to carry out daily activities, communicate, and participate in social situations. The effects of an autistic burnout can be long-lasting. It may last for a day, it may last for a week, it may last for a month, sometimes it can even last years. Therefore, it may take time for an individual to recover, and recovery is extremely important so as to prevent a full shutdown. Treatment for burnout involves reducing or eliminating the demands that are causing the stress, increasing rest and downtime, and providing support for mental health concerns, as burnouts can at times lead to suicidal ideation. It is important to note that autistic burnout is not a sign of weakness or a lack of effort. It is a real and serious condition that can have a significant impact on an individual's life. With appropriate support and understanding, autistics can learn to manage their stress and reduce the risk of experiencing burnout. Autistic burnouts can be caused by a range of environmental and social cognitive factors, and the specific cause can vary from person to person, but here are some common factors that can contribute to an autistic having burnout. 1. Sensory overload. Individuals with autism may become overwhelmed by sensory stimuli such as loud noises, bright lights, or strong smells, which can lead to sensory overload and burnout. Number 2. Social interactions. Social interactions can be challenging for individuals with autism, and prolonged exposure to said social demands, such as group activities or work meetings, can lead to burnout. Number 3. Cognitive demand. Individuals with autism may struggle with executive functioning, which can make it difficult to plan, organize, and complete tasks, and prolonged exposure to cognitive demands, such as schoolwork or complex projects, can lead to burnout. Number 4. Stressful life events, such as a move, a job loss, or family conflict, can be overwhelming for individuals with autism, and thus may contribute to a potential burnout. Number 5. Masking or camouflaging. Individuals with autism may feel pressure to hide or suppress their autistic traits in order to fit in or conform to social norms, and this can be exhausting and can contribute to burnout over time. During an autistic burnout, autistic individuals experience a range of physical, emotional, and cognitive symptoms. These symptoms can vary from person to person, but here are some common experiences during burnouts. Number 1. Physical and emotional exhaustion. Individuals may feel physically and emotionally drained and may have trouble mustering the energy to complete even the simplest of tasks. Number 2. Difficulty with communication and social interaction. Individuals may have difficulty communicating their needs and feelings and may feel overwhelmed in social situations. Number 3. Sensory overload. Individuals may become hypersensitive to sensory stimuli such as noise, light, and touch. Number 4. Difficulty with executive functioning. Individuals may struggle with planning, organizing, and completing tasks, and may have trouble with time management. Number 5. Heightened anxiety, depression, or other mental health concerns. During a burnout phase, an individual may experience increased anxiety, depression, or other mental health concerns as a result of burnout. 6. A loss of interest in previous enjoyed activities. Individuals may lose interest in hobbies or activities and special interests that they previously enjoyed, and may have trouble finding joy in everyday life. Suffering through burnout, individuals may need more rest and downtime than usual in order to recover from said burnout. Recovering from an autistic burnout can take time and effort, and the process may look different for each person. However, here are some general strategies that may help recover from burnout. Rest is crucial for recovering from a burnout, so individuals should prioritize self-care and allow themselves enough time to rest and recuperate. This may involve reducing external demands and increasing downtime, such as taking breaks throughout the day, getting enough sleep, and engaging in relaxing activities. Individuals should take steps to reduce or eliminate the stresses that contribute to the burnout. This may involve setting boundaries with other people, reducing work or school demands, or taking a break from social situations that cause stress. It can be helpful to seek support from others during the recovery process, whether from friends, family, or a therapist. A therapist who specializes in autism can provide guidance and support developing coping strategies and building resilience. Mindfulness practices such as meditation, deep breathing, or yoga can help reduce stress and increase relaxation. And by focusing on the present moment and allowing thoughts and feelings to pass without judgment, individuals with autism can reduce the anxiety that they feel and improve overall well-being. Developing a self-care routine can help stay grounded and reduce the risk of future burnouts. This may involve regular exercise, engaging in creative activities, relaxation techniques, or setting aside time for hobbies and interests. Individuals with autism may benefit from accommodation in the workplace, school, or social situation, and advocating for one's own accommodations such as reduced workload, flexible schedules, or sensory-friendly environments can help reduce stress and prevent future burnouts. Taking all of this into account, it's important to remember that recovering from autistic burnout is a gradual process and it may take time to regain energy and control, especially if an autistic has been in burnout for prolonged periods of time. Tomorrow's video will be all about shutdowns, but the following day will be a video discussing ways in which you can help your autistic loved one work their way through meltdowns, burnouts, and shutdowns. But if you yourself are autistic or are newly diagnosed and were in search of more information and found this video, and be patient with yourself through burnouts, and remember that it's a process that will take time and that it is always okay to ask for help and accommodations through the process. And let's go on, just before I log off, I have just one question for you. What is your next adventure?